Perfect. Thank you. So good evening, everyone, and thanks again for joining our Kawakib webinar series. Our guest today is Dr. Alison Beckman-House, who is Assistant Professor in the Division of Medical Ethics at NYU Grossman School of Medicine. She's co-chair with Arthur Kaplan of the Working Group on Compassionate Use and Pre-Approval Access, also known as CUPA, an academic group that studies ethical issues concerning access to investigational medical products, and which is composed of patients, advocates, clinicians, members of industry, former FDA staffers, lawyers, and academics, and I'm lucky to be one of them. A superb opportunity to learn and to grow in the field. She also co-chairs the Pediatric Gene Therapy and Medical Ethics Working Group, which includes also academics, patient advocates, industry representatives, and a wide array of clinical and research professionals. Dr. Allison wears different hats, and among those is her serving as the non-voting, non-paid chair of the NYU Janssen Pharmaceutical Compassionate Use Advisory Committee, also known as COMPAC, for infectious diseases in neurology, psychology, which is actually how we first met when I was invited to be a member of the superb group. COMPAC won the Reagan-Udall Foundation for the FDA's 2019 Innovation Award. And Dr. Allison has published and spoken extensively on how to best handle requests for non-trial access to investigational drugs and on related ethical issues. She has also written and spoken frequently on the history and ethics of using humans as research subjects and on clinical trials accessibility. Allison does not only have a superb intellect, but a wonderful sense of humor, as you must have noticed when we first met again, and willingness to ride new waves without any hesitation. Great to have you with us, Allison. The floor is yours.
Thank you so much. Let me just see if I can pull up my slides real quick. Are you able to see that?
Yep. Yes.
So I am really honored to be here, and I'm really excited to talk about something that is not 100% access to investigational medicines, because as Talia explained, that's where I do the majority of my work these days, and it's been a very busy year, as you can imagine, with regard to that topic. But I'm talking about something today that is actually a little bit more personal and historic for me, which is really this sort of public health ethics questions of, public health policy, ethical trade-offs, etc. And just to frame it, I want to say, I'm very multidisciplinary. I work in a division of medical ethics. I am an ethicist, but my division is within a department of population health. So I also am a public health professional. I work with public health departments, both in New York City, where I live, and elsewhere. And I have worked actually as a hands-on medical practitioner in Africa, as you will hear at a upcoming point in my slides. And even before then, I briefly thought I was going to be an anthropologist. So anthropologist turned public health person, and then at some point, when I really wanted to understand where these various policy issues were deriving from, I actually detoured and became a medical historian as well. So I'm actually going to bring all of that to the table in what I'm talking about soon. It's not going to be a straight ethical analysis. It's going to be a lot of contextualization, and a lot of that contextualization is going to be US-centric because that's where I live and that's what I'm familiar with. But I'm hoping that once I, lay out some issues, I'll be able to hear from you about what you think in terms of, do the sort of issues that I'm laying out or the framing that I'm seeing, do they translate, into your daily life and work, or do you think that there's something else out there that it would really be valuable for me to hear about? So that's enough background. We're going to talk about COVID-19 vaccine passports and really focusing on the ethical trade-offs, but within this sort of contextualized setting. And I just wanted to say that even if you wanted to, here in the United States, not talk about COVID-19 vaccine passports, it really hasn't been possible for at least the last 6 months, because it's just an ever-present topic of conversation. Oh, and I guess I should disclose that I'm speaking solely on behalf of myself, not on behalf of my employer or anyone else. So let me just give you a sampling of things ripped from the headlines here in the United States. So here's a recent headline. Governor of Alabama, so this is a very conservative state in the American South, signs bill banning COVID-19 vaccine passports. Here in neighboring state, also conservative, also in the South, again, governors banning COVID-19 passports. But then look, I live here in New York State in the north in a very, liberal slash progressive area, very politically different from Alabama or Georgia. And not only, have we not had our governor ban quote unquote COVID-19 vaccine passports, they actually created one themselves from the state. So you download this thing to your phone and you're able to show proof of your vaccination, if you go to a business or what have you. So very different policy approaches within the same country, just in different states. So you could say, okay, well, there seems to be this political divide between, more conservative states are really opposed to this idea, whereas more liberal slash progressive states are jumping on the bandwagon. And at first blush, here's something that might support that hypothesis. This is a libertarian slash conservative politician in another state here in the United States who tweeted, no vaccine passport. It doesn't get much more dystopian than be required to show your quote health papers wherever you go. You're like, okay, well that continues the trend. But then look, just a few days later, you get a different spin on this, which is a vaccine passport, which he defines as a unified central system for providing or denying access to everyday activities like shopping and dining, would be a nightmare for civil liberties and privacy, and would exacerbate existing social disparities connected to wealth, privilege, and race. And that at least made me sit up and go, well, this is interesting because things about exacerbating existing social disparities and concerns about civil liberties and privacy typically are not large talking points for the conservative wing of American politics. So, this is suddenly looking like a case of strange bedfellows. Continuing on, the ACLU, this is the American Civil Liberties Union, one of the foremost, sort of bastions of really sort of thinking about equity and thinking about how to provide civil rights and human rights for all. They're saying that there's a lot that could go wrong with vaccine passports. And then if you look at this is an article from a progressive leaning newspaper. A vaccine passport would be an ethical disaster right now. For a country still struggling to vaccinate its people, vaccine passports solve the wrong problem, but private industry desperate to reopen the economy is pushing for them anyway. So you're like, okay, well maybe it's the business angle. Maybe it's just the business folks who want it, and it's the civil libertarians, privacy folks who are more concerned. And headlines like this now suddenly jumping over to the UK, but I could have picked any number of things in the United States. Here's a business, British Airways, planning on having an app-based travel pass. So maybe it is sort of like the business community is endorsing this. Except here we go again, back to the United States. Resistance from health experts and business owners could doom vaccine passports even before they launch. And then you have to look, internationally and just say, well, what's happening in the United States completely at odds about what's happening in the rest of the world? And if so, why? Or are there really concerns globally? So here's Israel, green pass, vaccination certificate, certificate of recovery being used. Here is European Union, where these digital green certificates to allow free movement of citizens within the EU with this certificate is in process of being created. And then just yesterday, I think it was, this came out. This is a blog post from someone in Costa Rica who, is sort of turning their back on this idea of, yeah, we need these vaccine passports to enable, global movement of the masses, and saying, no, we don't need that. What we need is to get the vaccine to people, not people, across borders in a situation where only those people who can get access to vaccine are going to be able to go, because at least in my country, Costa Rica, only a handful of people are being able to get access. So I gave you that brief sort of tour of headlines just to say, A, this has been an inescapable topic, and B, just to show you the sort of, strangeness in terms of there don't seem to be clear dividing lines of who's pro-vaccine passport, who's anti, and really sort of on what grounds. So I just want to back up at this point and say now that we've seen sort of this, highlight reel of headlines, what is a vaccine passport? And there is no 100%, unanimous definition. And I think that's part of what the problem is because people tend to be talking past each other when they're talking about this topic. So a vaccine passport could be a certification that a person has been vaccinated against COVID-19 for purposes of international travel. That's sort of like the most formal definition, just like a passport allows a person to travel internationally. A COVID-19 passport is used for international travel purposes to show certification of vaccination. But some countries are using them for domestic travel and also as a way of, demonstrating certification of vaccination to allow access to certain establishments, activities, and events. And that's really where you see these sort of state level laws, in terms of New York and Georgia and Alabama creating these policies. I actually read all of those policies and they're different. So like one policy, the ban is that the state itself will not come up with a COVID-19 vaccine passport, quote unquote, whereas another one of the other bans was saying, no private employer in this state is going to be able to require these. So even when people use the same terms or come down on the same side of saying, we're opposed to this, they're not necessarily talking about the same thing. And so that's one of the complications of talking about this issue. And, just what is it? It could take the form of a physical card. It could be a mobile app. It could be a QR code, sticker on a passport. It could be any number of things as long as they're certifying your vaccination status. And then I put in parentheses here, and maybe naturally occurring immunity after infection, because some of these say, you don't actually have to be vaccinated. You just have to show that you have some protective level of antibodies, such as you could get of if you actually had a naturally occurring disease and recovered from it. And of course, all of this is in the context of uncertainty, right? We don't know how long vaccines offer protection. We don't know how long naturally occurring immunity exists within a person before it fades away, presuming it fades away. So this is all very much in the context of, the just the science is not set and we're still trying to wrap policy around it. But so just to back up for 1 second, obviously there's a long history of requiring vaccination certificates for international travel. And, I certainly have my WHO yellow card. Um, and to me, when I hear people talking about a vaccine passport for purposes of international travel, that rings many bells. I had to be vaccinated for yellow fever when I went to work in the Ivory Coast in Africa. And it just seems normal to me that countries would be able to stipulate that you might have to show proof of immunization to come into their borders. That being said, here in the United States, and I tried to look up the actual numbers to give this to you, and of course the numbers are all over the place, but I can say with certainty, it is a minority of individuals who actually have ever traveled internationally. Whereas the numbers varied, it's well under a quarter of Americans who have ever traveled internationally. And depending on where those who have traveled, they may not need, a WHO yellow card. They may not need a yellow fever vaccination. And so this is a very strange idea for some subset of the American population who have never been told, your ability to go somewhere depends on your vaccination status. And I just want to put here, and then we'll come back to this in a minute. I think a key issue here is whether these vaccination passport, quote unquote, programs are voluntary versus involuntary. So when I talk about, international borders and actual passport control agencies, that's involuntary. If I wanted to go to the Ivory Coast, I had to have the yellow fever vaccination. And not all vaccine passports are actually being considered as involuntary. Some of them are voluntary, and I'll get more into that in a minute, but I think that that actually, is a useful thought to put in the back of your mind as we're thinking about the trade-offs of these. So let's just get into the involuntary for 1 second. As I'm sure you all know, we have international health regulations, and the only disease for which countries may require proof of vaccination as a condition of entry is yellow fever. And the WHO can recommend that other, such policies be put into place. So, for example, right now there's a policy recommendation for Pakistan and Afghanistan with regard to polio vaccine, but these are advisory in nature. They're only recommendations; they're not involuntary, and they certainly lead to this sort of patchwork of policies. And now let's come back to the United States for 1 second, because in the United States, my country, things certainly started out as involuntary. So our first vaccine passport system, which was for smallpox, developed in the 1800s. And it really was this, empowered public health authority and state government saying, you have to show proof of immunity if you want to get on a train, or if you want to apply for certain jobs, or if you want to go to school. And, that doesn't mean that people necessarily liked this. Even then, there was a market for forged vaccination certificates, or, for the smallpox vaccination, typically it leaves a scar on your arm, and people actually, tried to figure out how to make fake scars so that they could avoid the actual inoculation, but still be able to do what it was they wanted to do. But by and large, within the United States, it really was sort of publicly accepted that if you're going to have the freedom to gather together publicly, or to go to school, or to ride a train, or to participate in community activities, this is just, what you have to do for the common good. You have to undergo vaccination, even if you don't necessarily want it, in order to participate in these activities. Um, and I put here a law. This is really sort of like the fundamental public health law in the United States. It was decided in 1905. It actually dealt with compulsory vaccination. And so, not certification or surveillance of vaccination, but the actual act of being vaccinated. And it said, it's very blunt. The liberty that you have as a citizen of this country does not give you an absolute right at all times in all circumstances to be free of restraint. It is within the police powers of the nation, or of the states within the nation, to require you to be vaccinated for the common good. And I highlight that to say, really in the initial dawn of these sort of sort of passport systems within the United States. And these also, they expanded internationally. At the same time, there was one in India for plague, etc. There really was this idea of, this is just common sense. You have to do something to protect the population from a preventable, potentially life-threatening disease. And it wasn't only the idea that, the common good could require you to get vaccinated against your will. Here in the United States, there was this, real sort of idea of, if you could be a harm to others, then, you're sort of, people need to be aware of you, and they need to be able to protect themselves from you, even if that means curtailing your normal everyday activities. So you can see here a placard from 1919. This would have been put on the front door of a house to say, hey, there's measles in this house. You people walking by, be aware of it. And also, understand the people who are inside, you now have restrictions on you. You cannot come and go. You cannot, have goods leave this house, etc., until the Board of Health comes back and takes this placard down. And right next to it, you can see in the New York Times, this is for polio, actually a list of patients and their addresses. Again, with this idea of, we have a duty to warn people where this disease, in this case, polio, is for purposes of, sort of protecting themselves. And this really has changed dramatically in the United States, and it changed, over time, as we really had this rise of privacy. And I just want to circle back a second to the headline I already showed you from the ACLU, where they said there's a lot that can go wrong with vaccine passports. To say that this is really the sort of issue that this organization has grabbed onto, and you can see underneath it says any proposal must primarily be paper based. We don't want like big computer systems in which people's data is input and suddenly you have millions of patient information. It's decentralized. Again, we don't want to have millions of people's data aggregated, and protect privacy. And a lot of concern that, any sort of vaccine passport system that is put up really needs to deal with these protections. We need to avoid the centralized databases. We need to avoid the possibility of data breaches. Who has oversight? Who gets to opt out? Who gets to control what is done with the data? Can researchers do secondary analysis of this data? Is that acceptable or is that not acceptable? And really, who gets to decide? And I want to come back again to this idea of voluntary versus involuntary. So if this was an involuntary governmental thing, your ability to control what happens to your name and your data would be far less than if these are sort of piecemeal individual systems. And so here in the United States, there really has been uh, vehement opposition to there actually being a government database that would form the basis of these passport um, systems, and really much more of a reliance on, well, an individual employer can do it just for their employees, or maybe a state can do it for, people within that state who opt into it. But our President Biden, has actually said that there is not going to be a federal database. Now, that could always change. Yeah, if I've learned anything over the last year, it's that policies can change, but at this point in time, it really doesn't seem likely in the United States. And so what we have been doing is, as we get vaccinated, we actually get paper forms, that says your name and what type vaccine you got and when you got it. And even with that, you can see people are concerned. So here's the sort of warning that has been circulated. This card that has your name and the vaccine you got and the date that you got it has sensitive personal information. Don't share pictures of it online because it could put you at risk of identity theft. It could show where and when you were vaccinated, which could actually, open you up for even more sort of manipulation of people who want to use your identity for their own purposes, etc. So we really are in a very different situation from, just to show you these pictures again, this time and day where it was routine policy to make it publicly announced of who was ill. Now we're not even talking about people who are ill. We're talking about people who are vaccinated, and really this sort of, severe adverse idea of having either be like this centralized list of who got the vaccine. And, I'm sure people have seen pictures in the United States and from around the world, people who really have sort of said any restriction of my liberty in the name of public health is really unacceptable. So here's a protest about, why do beaches and trails need to be closed down in the middle of a pandemic? And, I think people could argue about what sort of situations are more or less risky. But there really is this idea, at least some subset of the current American population, that any restriction is really uh, too far a bridge. And I just want to say, COVID-19 passports, they are not in any way, shape, or form necessarily linked to mandates, but there is this requirement that if you're going to have a mandate, you have to have some sort of proof of vaccination. So when you see people who are raising objections to these passport systems, quite frequently, if not in the first sentence, a few sentences down the line, there comes up the idea of a mandate. So I'll just say, for those of you not familiar with, the sort of US situation, governmental mandates are pretty widespread for children to go to public schools. Some employers, such as my employer, may have a vaccine mandate, so we're required to get the annual flu shot as a term of employment. And many states require accommodations for people with religious or philosophical objections. So there are certain people who are able to be carved out from these rules. Um, And of course, this is complicated even further right now by the fact that we are not dealing with a vaccine that has been fully approved by our regulator. In the past, almost every time we've had sort of a public campaign to get people to use a vaccine, it's a vaccine that has been FDA approved as being safe and effective. And we're not dealing with that at the moment. We're dealing with vaccines that are used under emergency use authorizations. And I see that there's a typo there. That should be EUA instead of EUQ. So sorry about that. And then I just wanted to, hit one last thing on the mandate point before we go back to, specifically dealing with the passport idea, which is just to say, so again, this is all people talking about governmental mandates that may be required unless you meet one of these exempted categories. But what about private mandates? The idea of my employer can tell me to do this. And this is complicated in the United States too, because again, there are laws that say to employers, well, you can't require people to do things that are against their religious objections. You can't require them to do things that are medically contraindicated. You have to provide some sort of accommodation. But at the same time, there are also laws that say employers must provide safe workplaces. So this is something that's going to have to work its way out in the court system in terms of what these private employers or private entities can require. But at this point in time, people really are sort of focusing in on voluntary measures for the most part, saying, we're going to give you a bonus, or we're going to give you time off, or we're going to do other things to really sort of encourage you to get vaccinated, but not requirement. And I'm going to drop that topic for a second because mandates is the second issue. So to go back to this idea of vaccine passports itself, one of the major issues that people bring up, other than the fear that this is sort of the slippery slope to a mandate, is the idea that we're in a situation of extreme inequity of access to vaccines. And if you then suddenly start saying your ability to do or to travel places is going to be linked to your, having procured the vaccine, then you're just going to entrench the existing hierarchies that are already there. And so, I'll just say within the United States, we know that there's racial discrepancies in who's been able to get vaccinated. We know that there's discrepancies of wealth and access to healthcare in terms of who's been able to get vaccinated. And this really extends across the entire world. We know many people in low and middle income countries have no possibility of getting vaccinated this year, maybe not even next year, maybe not until the following year. And so if you say you can't travel for work, or you can't, come to a US university or what have you without having proof of vaccination, you're really, setting up these sort of uh, uh, disparate hierarchies again in terms of who could do what. And, on one hand, the solution is simple. We just need to get rid of the scarcity. We need to flood the world with access to vaccines. And then, we don't need to worry about there being these entrenched hierarchies. On the other hand, that's obviously much easier said than done. And what do we do in the interim? Given that we're trying to control a pandemic, we're trying to keep people safe, but at the same time, we don't want to do so, on the backs of the less privileged. The WHO put out an interim policy paper in February. I have put the title here. You're welcome to look at it on your own. Really encouraging countries not to set up these sort of vaccine passport systems at the moment, particularly on this idea of the fact that there is inequitable access to vaccines, and that this will be an infringement on the ability of certain people who are already disadvantaged to get vaccine to be able to take part in other opportunities. And I want to note, these are not necessarily discretionary opportunities. It'd be one thing for someone to say, look, you can't go on a vacation to some, you know, uh, uh, foreign country. You can't go to the beach in Spain this year because you're not vaccinated. That's, a discretionary thing, what people might find irritating and upsetting, but it is not the same thing as saying, like, you cannot join your family in a different country, or you cannot seek medical care, or you can't get a job because you don't have this. And then I want to point out that, I've been talking about equity of access to the actual vaccines, But there's also a question of equity access to the vaccine passport. So I mentioned earlier that, some of these could be governmental, some of these may be non-governmental. Well, if it's governmental, that's gonna, lead some people right off the bat to be loath to participate. So just in my own country, we have, people who are here illegally or people here, sort of quasi legally, and the idea that they would want to go interact with a government agency, share their name, share, potentially information about where they got their vaccine, et cetera, really, does not seem likely. And so, again, you'd be sort of building upon those existing entrenched inequalities if you say you have to have some sort of interaction with government. And then there are other things. So, who has time to take off from their job to go do whatever needs to be done to get this vaccine passport. And even if it's something that is as, quote unquote, user friendly as just downloading an app to your phone, well, who has access to phones? Who has access to reliable internet? Who, again, is, secure enough in their interactions with the government to be willing to download something if it's, say, from a government website, et cetera. So I think there are also issues here about just how do you get your passport. And I think that's why in the United States right now we're still using just the old-fashioned paper form. And so I'm almost done. I just want to, circle back and say, what's the purpose of these vaccine passports anyway? So obviously the whole idea of trying to, have some idea of who with what vaccine status is doing what is to try to protect people from disease. And as I've already pointed out, we have established that countries have a right to limit entry into their countries. But I think the more complicated question is within a country, how do we use these vaccine passports, and are they really going to be fit for purpose? So within a country, until you have herd immunity, I think the main idea is to use these vaccine passports to really limit participation in certain communal activities to those who have been fully immunized. And this has sort of a two-pronged purpose. One, it allows, sort of quote unquote resumption of normal activities because people can go out and do things like here in New York City. You can dine in restaurants again. You can have more people in a indoor facility than you had been able to do before. You can go to ball games again, et cetera. And all of these, they're not just social activities, they're not just communal activities, but they're economic activities. So there's this idea of we can start lifting some of these restrictions. We can get people feeling more normal again. We can allow, economic vitality to start coming back if people think that they're going to be safe. And so use of these vaccine passports really has this sort of utilitarian bent of we're going to allow people to feel like they're safe again. And, this also has that sort of background idea of if people are able to do more once they have proof of vaccination, it'll urge them to go get vaccinated. So we'll be able to get closer to that goal of herd immunity as sort of, a sort of not on the surface idea of why we need a vaccine passport, but as sort of a foreseeable consequence. And then the last thing I want to say is, how have we protected people up until now? These things such as stay-at-home orders, limiting capacity of buildings, et cetera. So this is an idea of those were really restrictive. And now maybe by transitioning over to this, proof of vaccination, we can actually start scaling back on how, intrusive and restrictive of measures government is actually having to impose in the name of public health. And then, really the question that comes up is all of those sound reasonable, but will they work? So here in the United States, it is possible to buy fraudulent, the forms that come with your vaccine. And so, are we going to be in a situation where people really are able to get the foreseeable benefits of vaccine passports because we as a common entity say, here's a middle ground. It's not great for everybody. It has some foreseeable concerns, but at the same time, it really is in the name of the common good, and we're going to join together and do this. Or are we going to have a large enough minority of people try to game the system that suddenly it doesn't work for any of us. And obviously, if we start having this sense, if we start seeing epidemiological data that this system is not working, if it's not fit for purpose, then that's going to undermine the whole thing, and we'll have to return to the more restrictive measures. So we don't want it to be a situation in which, right now we have this idea of there's theater. If you wash your hands, and if New York City scrubs down the metro stations at night, the subway stations, people see that we're trying to do something to protect them. But no one's really sure how effective some of these measures are. We want to make sure that if there is a vaccine passport system in place, people actually see it as being fit for purpose and useful, not just sort of another example of theater that doesn't do what it was supposed to do and leaves us unprotected. So I'll just pause on this last slide and say, really the sort of fundamental goal of public health ethics is to try to figure out how to protect a population of people, but with the least sort of undue restriction or intrusion into the lives of those people as possible. And so we have a toolkit. We can say, well, we just need to educate people. If they all understand, then they'll do it voluntarily. Or maybe education's not sufficient. Maybe we need to persuade them. Or maybe, we can use a nudge to say, persuasion wasn't quite there, so we're going to actually try to set up, structural circumstances to push you the way we want you to go, but it's still voluntary. Or we could start being a little bit more, intrusive and say, okay, well, if you don't do this, there's going to be a penalty. Or, you can do what you want, but only in a certain area. And these other areas you have to do as we tell you. Or you can finally just say, we're going to mandate that this happen. So we've been, going through this toolbox at a rapid clip during the pandemic, at least here in the United States, trying to figure out how to balance this idea of protecting the populace without unduly, penalizing individuals or communities within that population. And so I think vaccine passports are just another example of this, of saying, if we can have a workable system where people really do think that their safety is going to be enhanced by this, then we can loosen up on some of our other restrictions. And so the question for me that I am waiting to see is, does this actually work? Will we really be able to loosen up the way that some states and cities are at the moment, or will we not come together in common purpose and find that this is not actually a workable solution? So I think I'm going to stop there. Talia, I turn it over to you if you want to moderate a Q&A, but I'm happy to hear anyone's thoughts. And again, as I said, this is a very US-centric discussion, so I would love to hear anything you want to add to it that I did not talk about outside of the US.
Okay, thanks a lot, Alison. That was dense. You did touch on almost all important issues, so thanks a lot. I have one question before and I will allow myself only one question as moderator. Um, so you know that the WHO is granting approval to some vaccines and not others for emergency use. And yeah, for example, so far Sputnik has not been approved, whereas Pfizer has been approved, Moderna has been approved, even Sinopharm has recently been approved. So I'm thinking of people who need to travel to the US and the UK and to Russia for work, and they cannot have both vaccines at the same time. It simply doesn't work that way. Is this not some form of discrimination? So they can go to one work and not the other? Or some people can join their work, others cannot, simply because they have taken the wrong kind of vaccine?
And I will answer that in 1 second. Let me just clarify for a second. I tried to stop sharing my screen. Is it still showing or?
Still showing.
Oh, shoot. Okay, well,
Try again, stop sharing,
yeah, I don't, let me
because
see.
we definitely prefer seeing you now. Tala, can you help?
I got it. I got it. There
You
we
got
go.
it. Good, good,
It
good.
was a big red button that I somehow wasn't seeing. So there
All
we
right.
go. Is it gone?
Yes.
So yeah,
Yes.
so you're absolutely right, right? So right now there is no one size fits all approval of a vaccine, and certainly no vaccine is available globally. So when you start putting in these restrictions of saying, you have to have proof of vaccination in order to be able to come into our country, what does that mean? Is there a list of, just these WHO approved vaccines is available? Or just are sufficient to allow you in, or just the ones that our regulator deems sufficient. And so this really does add to the inequities of the moment in terms of, I got Pfizer. I have a feeling I would be able to travel many places with my Pfizer vaccination. But if someone got one, the Sinopharm or something, and the United States says, no, we don't think that's sufficient, obviously that's yet another barrier to entry. And it may not be an appropriate barrier to entry, especially if that is a reasonable vaccine. And the place where I see this happening a lot right this second is foreign students coming to the United States. Because whereas I said in many cases, private industry or private companies are using voluntary measures, the one stunning example to the opposite that we're seeing is universities actually requiring students be vaccinated. But but what do you do about the fact that they say, okay, I've got vaccinated, but it's not a vaccine that is being used in the United States? And is the university going to allow them to come in? Is it not going to allow them to come in? Huge area of
Yeah.
concern that needs to be figured out very soon, because our fall semester will start here in just a few months.
Oh, yes.
And
Particularly if their country of origin requires a different kind of vaccine. So
right.
either home
Yeah,
or
I mean,
education.
I really think, I mean, if I were queen of the world, which I'm not, I would, really be pushing WHO to actually try to amend the international health regulations as quickly as possible to get some clarity into the situation. But, that is obviously a huge lift simply because anytime you do something on a national
Definitely.
policy basis, it's difficult.
Thank you, Alison. Anyone wants to ask any question or comment or? We have one comment from Lucy in the chat saying, in my opinion, the problem actually is that we do not trust the vaccines themselves, since they are not invented from the natural virus, similar to the traditional ones.
I wanted to put a slide in that I decided I just didn't have time to, but I have this stunning slide that shows the length of time from identification of a virus to actual, commercial availability within the United States of a vaccine. And you can see that in many cases, these are decades, right? So, and in some cases, we've never reached that area of commercial availability of a vaccine. So, for example, HIV, we still don't have an effective vaccine. But the point is, if you just look at this timeline, you see these lengthy periods of time during which vaccines have been under development. And I think one of the huge concerns, at least within the United States, but also globally, is just the fact that in this situation, we came up with vaccines so quickly that people are just sort of thrown off balance, and they're like, well, this is not normal. This doesn't seem right to me. Why was this so fast? Maybe this was more political manipulation, or, people keep telling me, well, it's just a different type of science, and the science has been in development for years. But okay, well, that doesn't make me feel any better, because when you say it's a different type of science, what does that mean? Does it have different side effects? Or, is it going to change my DNA? Should I be scared about this? So I really think if you look at that public health toolbox that I closed with in terms of actions that public health authorities can use, a lot of conversation right now is on mandating. Should we mandate vaccines, et cetera? Should we set up these restrictions on you can't do this unless you're vaccinated, et cetera? And I would just urge public health policymakers that even as they're contemplating that sort of far into the scale in terms of the more restrictive policies, they not forget about the other side of the scale, which is the education and the persuasion.
Yeah.
So I think we desperately need to explain to people why it is we think these are safe, why it is we think they're effective, and to look and see who they find convincing voices and try to rope them into the persuasion effort of saying, you know, you may not trust the government to tell you this is safe, but you might trust your religious leader, or you might trust, the celebrity you follow on Instagram, or whatever it is that you are actually going to be more trustful for to pull them into the effort. So I think that there's a lot of attention right now on the idea of mandates and these sort of restrictive policies, but we cannot forget the bedrock, the persuasion, the education.
So, what's your take when I'm not going to call them patients, but the receivers of the vaccine have no say in the choice of the vaccine, particularly asylum seekers, migrant workers, refugees? What's your take on that?
Yeah, I mean, that's a difficult question. I'll tell you, I got offered vaccine early as a employee of a health center in New York City, and I don't treat patients. I didn't think it was appropriate for me to be, among the first wave. So I wanted to sit back and wait and be like, give it to people who are more at risk than me. And the thing that actually pushed me to go forward with getting it done is they started talking about how Pfizer and Moderna vaccines were going to run out, and at some point we were going to start getting AstraZeneca. And I thought, I don't want AstraZeneca. AstraZeneca sounds a little scarier to me. I'm not as comfortable with it. I better go get it now. So, just given my own personal history, which I'm divulging to you, it would be incredibly hypocritical for me to be like, people should not have choice in vaccine.
Mhm.
So I really, when I hear people here in New York City who run public vaccination sites, and they say people walk in and they're like, "Oh, it's J&J, I don't want it," or
Yeah.
"Oh, it's Pfizer, I don't want it." And I think that's okay. You know what I mean? Honestly, I think people get to make their own decisions about what they want to put in their body. And if there's a real reason to believe that they're all interchangeable, it is on us as public health officials or people in the environment to try to persuade people of that, and not just to say, you know, you don't get a choice. Now, in many cases, there's not going to be a choice. There's literally only going to be one option, and in that case, it's take it or leave it. But where there are options, I don't feel comfortable saying people shouldn't be able to choose.
So you see, Alison, and I'm not going to take more of your time. At one point, our government has decided to give AstraZeneca to teachers.
Mhm.
So it's occupation related. What's your reaction?
I mean, I don't know about the idea of restricting access to a particular vaccine by occupation, but the thing I have thought a lot about is by mandating it by occupation. As I said, I work at a hospital where we are required to have annual flu vaccinations. I am convinced as soon as the COVID-19 vaccines receive full regulatory approval instead of
They
just
should get it.
provisional, we're going to be mandated to get it. And my husband is a high school principal in the city, and I'm convinced he and his colleagues are also going to be mandated to get it, as sort of the need to have schools in session to really allow the economy to resurge.
Yeah.
So I think that those sort of mandates are coming. I don't think that there's much we can do to avoid them, but I really, to me, the line that I am drawing is I don't think you can. I'm very opposed to the institutions, that the universities that are having these mandates for vaccines that are not yet fully approved. To me, there's a significant difference between saying you must take this thing, but we have determined that it's safe and effective, versus you must take this thing and we have not yet determined it's safe and effective.
I see.
So I would say, with your example of teachers getting AstraZeneca, my hope would be that it is, already has full regulatory approval in your country, but I don't know if that's the case.
Yes. Well, there's a joke running among teachers now that students anyway cause stroke to the teachers, so AstraZeneca is not going to do anything. So, Alison, thanks a lot. Anyone else? Yes, Sarah Hamid, I believe that we have a duty of do no harm. How do you respond to those who don't want to get the vaccine, especially if they are working in healthcare in low and middle income countries?
So I mean, that's interesting. When you say a duty of do no harm, what is the harm? Is the harm saying get a vaccine or even a vaccine that is, not fully approved, or is the harm allowing people to work in a situation at which they are at risk? I would argue that both of those are potential harms, and then you're weighing, well, what is the potential harm of this vaccine versus what is the potential harm of working in a healthcare setting without the vaccine. So if you're in a healthcare setting, the rare healthcare setting in the world where there's great PPE and there's great social distancing and there's, reverse air circulation. I mean, if it's just like an incredibly safe place, then maybe it's not appropriate to say that you need to require vaccination of those employees. But I think many hospitals are not in that situation. And so I'm pretty okay with saying we're going to mandate vaccination after the vaccine is fully approved of those employees. Remember, vaccination, even of approved products, always has a risk, right? There is no 100% risk-free vaccination.
Of course.
But I think there's certain levels of risk that we think are reasonable to ask of employees.
Definitely. Alison, thanks a lot. Warm wishes to you and to Art.
I will pass them along. It was really lovely to hear from you, and thank you for everyone for your time, and have a great evening.
You too. You too. Have a great day. Bye, Alison. Thank you.
Bye, everyone.
Bye.
Feel free to email if you want to follow up on anything.
Thanks a lot. Okay.
Okay, bye.
Bye.